guys, welcome back to my YouTube channel. On today's video we'll be looking at femoral triangle is that wedge triangular shaped structure, that depression located on the anterior medial aspect of the anterior thigh. So we're going to look at it we're going to look at the boundaries, we're going to look at the contents and the clinical correlation on this femoral triangle. Okay, so the boundaries of this femoral triangle, it has about 3 borders. We have the medial border, we have the lateral border, we have the superior border, we have the floor, and we have the roof of the femoral triangle. Okay, so the superior border is bounded by this ligament here called the inguinal ligament that extends from the anterior superior iliac spine to the pubic tubercle. Okay, so medially we have this muscle here called the adductor longus. Laterally we have another muscle here, the longest muscle in the body, which is called the sartorius muscle, that extends as well from the anterior superior iliac spine to the
medial condyle of the tibia, as well as attaching to the medial condyle of the femur.
And then we have the apex. So this apex is a junction where the sartorius muscle overlies the adductor longus. So this area here is the apex. Okay, so we have the floor. So this floor is formed by this muscle here called the pectinate muscle that is located medially, and another muscle here called the iliopsoas muscle, and the iliacus muscle. So when 2 of them come together, then now becomes what we call the iliopsoas muscle. So sometimes this adductor longus here can also be the part of the floor of the femoral triangle. So let's look at the contents, things that we can see within this femoral triangle. We are going to start from the medial to the lateral aspect. The things that we can see from the medial to the lateral aspect. The first thing we can see is this structure here, this node. So this is called the deep inguinal lymph node. Okay, so it is found within the inguinal ring inferiorly. It is found in the medial aspect of the inguinal femoral triangle, lying on the pectineus muscle. So when we go more lateral, we see this vessel here. This is called the femoral vein, which continues from the external iliac vein and crosses the inguinal ligament to become the femoral vein. So when we continue moving lateral, we see this structure here, which is the femoral artery. Okay, so this femoral artery is found on the midpoint of the inguinal ligament, so between the anterior superior iliac spine and the pubic tubercle. So you can see it is located in the middle, in the midpoint. Okay, so this femoral artery has about 6 branches within the femoral triangle. We have the 3 superficial branches and 3 deep branches. And within these deep branches, we have one big branch here, which is called the deep femoral artery, that has another branch coming from it, which is the lateral circumference femoral artery and the medial circumference femoral artery that supplies the hip joint. So most lateral is this nerve here called the femoral nerve. So this femoral nerve extends from L to L4. So mainly locating from the posterior trunk of the lumbosacral plexus. So it has about different branches. We have the cutaneous branches and muscular branches. Okay, so in clinical correlation regarding this femoral triangle, there is what we call the femoral hernia, in which structures from abdominal content can pass through this weakest point of inguinal canal here called inguinal ring. So in a case of femoral triangle, we see the intestinal loop here passing through this opening here, this structure, and be localized in this inguinal femoral triangle, causing what we call the femoral triangle, which is more prone in females, especially pregnant women, due to increase in pressure of the abdomen. And as well, this femoral artery here can serve as a catheterization, in which a kind of tube-like structure is passed through into this femoral artery, and then they can use this tube to localize, to find their way into the heart or into the coronary artery, and then a kind of dye is inserted through this place for easy localization of the coronary arteries. And then it can also be as an access to withdraw venous sample, arterial sample for different analysis. Secondly, this femoral artery can serve as a means of femoral pulse. It can be used to dictate the femoral pulse on the body.